cases of the coronavirus are trending upward nationally, but that's not the whole picture. While cases are on the rise, COVID-19 deaths remain relatively low. Well, take a look at these numbers. Since the beginning of June, even as case counts have jumped up, that's the blue line that you're looking at. The fatality rate has continued to go down. That's the orange line there. And now more testing does produce more positive results. But what we're learning is that the fatality risks are lower because those getting tested are younger and not at risk. And if you compare this to the earlier this year, between March through mid-May, where the graph is lockstep between confirmed cases and deaths, and why is that? Well, it's because those getting tested were older and at-risk patients. And the current increase in positive COVID-19 tests comes as social distancing practices have been broken down. You might have seen that this weekend. Well, a lot of those confirmed cases have not resulted in deaths. It doesn't mean that there's no longer a risk out there. Joining us now is our panel, Florida emergency medicine specialist, Dr. Peter Hibberd, and healthcare analyst and author of The Cure, a blueprint for solving America's healthcare crisis, Seth Denson. Gentlemen, welcome back.
Good to be with you. Thank you.
Well, Dr. Hibberd, there is a lot of conflicting information out there, and we keep seeing, I think, every day a state rise in cases. But I want to pull up a graph for you that's kind of interesting and puts things a little bit into perspective when you look at it on a global scale and you look at death rate per million by country. The U.S. is relatively low with just 400 per million compared to some of these other countries. And sometimes the media is trying to freak us out. We have the most cases overall. And one of the reasons we actually shut down the economy in the beginning was not to overwhelm the hospital system. Do you think that we are now in risk of actually overwhelming and getting to capacity again?
Well, let's place those numbers in perspective. If you break the USA figures down, it's a mixture of low-risk states and higher-risk states. And the number for New York was close to 1,800 deaths per million. And the numbers in Florida are around 170 to 180 per million. California's not far off that. So when we look at the total national figure, it is skewed by the Northeast states that had terrible, terrible death rates. And at the moment, it's also combined with states that hardly have any. You've got places like Arkansas that have 95 deaths per million. It's very low. Factor this into the deaths per million in Spain or between 600 and 700. Italy, similar. France, 600 per million. So the 400 per million average across the United States is a terrible figure. It should be less than 100 for the state of our technology, and it's disgraceful that it's that high.
So Seth, let me ask you, how do we become, like a smart consumer of COVID-19? There's so many different statistics. A lot of people are spinning things left and right, so to speak, and in between. How do you make sense of all of it ultimately?
Well, it's difficult to do so with the mixed messaging we're getting throughout multiple media channels, right? And I think that the best thing that I would tell people to do is get out of whatever echo chamber you're in, where they're feeding you what effectively they want you to hear, and really start looking at the numbers. The doctor's right. I think that in a society like ours, with an American healthcare system that's responsible for the vast majority of the world's innovation, it's a shame that we're seeing this as much as we are. But that's the reality that comes back to the fact that the American consumer, by way of healthcare, is a bad consumer in general. We just don't focus on our health as much as we should.
Dr. Hibberd, we saw the reports on hydroxychloroquine last week. They seem pretty positive. Do you think that this could be a bridge until we do see a vaccine?
Well, I don't think the information on hydroxychloroquine has changed a lot at all. I think the FDA got somehow bluffed into taking the EUA away when they should not have. And unfortunately, they're going to have to backpedal on that. There are other drugs that are up for repurposing that the FDA needs to strongly look at. They didn't look at hydroxychloroquine effectively enough, and they needed to. They need to look at other drugs like ivermectin and some other medicines that are repurposed and that work in other countries. And there's no reason in the world for us to ignore them. So hydroxychloroquine, the results weren't that great by itself, but I was honestly surprised with how good they were. But at the time that President Trump took his hydroxychloroquine, we already knew that this study was going on in Detroit and Atlanta. And we knew the results were good because the infectious disease channels had personally told me so. So I knew that Trump was not on the wrong wagon. It's just that the anti-Trumpers came and jumped him so badly that we politicized our drug treatment.
Is there another drug out there that you think is showing more promise than hydroxychloroquine?
Well, honestly, there's an ivermectin group that really shows some relatively good responses too. And I think we're looking at 40 to 60% mortality decreases with ivermectin in the ICON trial in Fort Lauderdale. Now, the investigators have had trouble getting that published. And so the lowdown here is they're probably going to have to team up with Gilead, with remdesivir, that has a significant financial following in order to get some of these other drugs out there.
Seth, I want to ask you about masks. They've unfortunately become political in nature. It's really kind of the nature of the beast, if you will. We live in that toxic world, in a politically divided world. But what do you make of masks as the future in America? I mean, I think a lot of people are wondering, oh my gosh, am I going to have to wear a mask for, I don't know, ever? What's your sense about how long we're going to have to be with this new normal, if you will?
I think there's two components to that, right? One is as we start to work through a vaccine, and the second is herd immunity. And I think as we start to see this virus, become kind of fought in those manners, we'll start to see the relaxing of masks. Sadly, this is a politicized statement, and I had this argument with somebody in my family this weekend who said, well, it's my constitutional right. I said, well, the Constitution doesn't mean you have to wear pants either, but we need you to do it right now, and we all need to come together and fight this together, and then that way we can get beyond the mask. But the one thing we don't want to do is have our economy shut down again. If wearing a mask means we don't have to do that, well, then sign me up. I'll wear the mask.
Dr. Hibberd, we saw a lot of people out gathering this last weekend with holiday weekend, obviously rise in cases. What do you tell people who are trying to get out there and go to the pool or have a barbecue? Is it safe to do that, or is the message the same? Isolate and stay home.
Well, the at-risk people are staying home. We see that from the numbers. The younger people are getting out. They're ignoring some of the masks and the other protection measures we've suggested, and we've seen the numbers double in the last couple of weeks. And we're going to continue to see that. We won't see the deaths for 3 or 4 weeks. And it's not the young people that are going to get it. It's the people that get it from the young people. And this exponential increase is looking like it's going to continue. I'd like to add, though, masks are awful for everybody. No one likes them. And maybe we ought to be looking at other things like face shields for some who can't tolerate a mask.
Well, that's interesting. I was going to ask you about some other options beyond masks. I mean, not that we shouldn't be wearing masks, we should. But Seth, I am curious about, from a political standpoint, a messaging standpoint, the president and masks. I mean, I tell you what, he says, look, I'm going to be the law and order guy, but he's not going to do anything with a mask. I kind of understand that to a degree because he's not around big crowds mostly.
Well, listen, I'll let the president speak for himself. He surely has qualified people to do that for him. That being said, take a state like where I'm at in Texas, right? You've got 28 million people, over 300,000 square miles. And hotbed areas like Dallas or Houston are very different than those in Midland or San Angelo. And so I think for us to paint the country with this broad brush and say everybody has to treat this exactly the same based on the geographics is naive. And so we need to start managing it based on our local political spectrum and our local authorities.
Dr. Hibberd, Seth, thank you so much for your insights and being here with us.
Thank you.
My pleasure.
All right. Well, up next, we're going to continue the conversation on COVID-19 with political analyst Dick Morris on how the rising case count could impact the presidential election in November. And then we're going to bring in our company to break down the latest SCOTUS decisions. And later, evangelical leader Ralph Reed will be here to discuss what Trump can do to keep that base in November. Stick with us.